All right. Well, hello again. And we are today kind of experimenting on the one hand. On the other hand, it's, peer-to-peer exchange as usual, Friday afternoon, where to spend your time, if not to get tips and tricks on something that matters for everyone. And so I will just step back a little bit with the context. So Neil here, you all remember Neil from our batch, has texted me once in, I think, November or something like that. Saying that unfortunately Sprit can no longer be a part of the program because there is an exciting news ahead and a fundraising round has been closed, etc., etc. And I couldn't make myself kind of stop on that point and just say, okay, the best wishes, etc., etc. Of course, I've said that, hopefully. So again, best wishes and congratulations and kudos. But I couldn't just stop on the idea that it can be also very useful for all our founders to kind of get to know how is it now going? Because everyone speaks about economic recession, investors not investing, founders not attracting capital, and so on and so forth. That these real examples, especially now, really it would be really useful to kind of get to know and to maybe learn something new, best practices, and so on. So thank you so much, Neil, for accepting the invitation on that. And I suggest we are going the following way. So this is a 1 hour. We will have partially questions from our side, just to know overall on fundraising this time and maybe some tips and tricks general. And then we will have definitely some time for open microphone. So any one of you, just please go ahead and comment, agree, disagree, ask, everything like that. So I hope that sounds good. Okay. So I see your notes. So, some of you. Okay. Okay. Perfect. So Neil, hello. Thank you so
Hi,
much for
how are you?
accepting the invitation. Yes. Can you, hopefully that you're doing fine. And probably let's start with a timeline, like timeline wise, the preparation for the fundraising. So remember yourself and your team at that moment. Why did you decide to fundraise? How did you define the amount of money? Like, where was that point then when you just like, okay, after this threshold, we're going and we're doing the fundraising part.
Um, okay, so there's nothing glamorous about this, and there's no real there's no real plan, right? So we had a plan. We knew we needed a fundraise. So we'd opened our round in April of last year. Um, so initially it was a seed round. We're initially looking to raise 2.5 million. We're Irish, so naturally we went to Irish VCs, UK VCs, other European VCs. And we had a lot of conversations, we had a lot of meetings, we shared a lot of data rooms and documentation and everything else going back and forward. Being completely honest, we had two what I'd call near misses, as in we went to uh, heads terms, we went to term sheets, and then all of a sudden both funds ran out of capital or couldn't deploy capital, like
Mm,
for at least one was 6 months, another was could be 12 months, 2 years till they were able to bring in capital. Um,
mm,
and so in the interim, prior to that, we had raised a pretty successful pre-seed. Which was all angel investors, high net worths. So we raised just over 2 million on the angel investors, pre-net worths and grants. All right. So
mm,
um, and we did quite well at that. But through that, we got kind of adept at building a data room and what we had to have in our data room, what we needed. We're lucky enough that one of our co-founders is a CFO, was a CFO and ex-accountant and had done this before. So he had all our management accounts ready, he had all our finance was ready. We had our go-to-market strategy developed. We knew exactly how much we were going to spend and when we were going to spend it. So what happened is we went to an event. So we went to Health, which is like one of the biggest health events in Europe. And we went to that in Amsterdam in June. And we met with Mayo. We bumped into effectively. We had a stand. We were pitching at the startup event at it, and we bumped into Mayo Clinic. They just happened to be there, and we got talking to them, and they said, "Look, we have an accelerator, right? But we also have Mayo Clinic VC fund, right? And we have a massive problem. So we just give people a reminder. What we do is we predict the likelihood of no-shows for clinical no-shows, and then we use behavioral science, psychology, and language to change the outcome. We've no apps, and we exist across things like WhatsApp, SMS, RCS, Telegram. So the patient doesn't have to download anything, and we plug directly into the health systems. So uh, we applied for that. We got into what they call the Mayo Clinic Innovation Exchange, which is basically effectively like a, for a better term, sort of like an app store or an
Hmm.
iStore for digital products within health. And if anybody within the Mayo Clinic network has got a problem and they need a solution, they have the option to reach out and organize a pilot and different things like that. So we did a pilot with them, which was on um, uh, basically fertility clinics. So they in the US and Florida, so they had quite a high number of no shows. So we did a
Hmm.
3 month pilot. Pilot went well. We increased turn up by 45% in 3 months. So we got into conversations with them, and they were like, "Look, we'd like to invest in Sprite, but we're not a lead investor, so you need to find a lead, right? And we'll go in on whatever terms." So in the interim, we got introduced to a company called MediDrive that's part owned by Uber. So they do what they call non-emergency medical transport. So basically, effectively taxis
Hmm.
to clinical appointments or hospital appointments. It was always kind of on our roadmap that it's all well and good predicting a no-show, and it's all well and good making sure the person books it or reschedules it, but then how do we get them there? How do we make sure they turn up? So it was always a roadmap to try maybe work with Uber or Lyft or somebody like that to try. So this just happened to land on our lap, and they work with Uber, Lyft, taxi companies all over the US, South America, and Middle East, and they're trying to get into Europe. Um, so we met with them. We told them we asked could they make an intro into the VC that originally backed them, which was a company called HC9 or a VC called HC9 out of New York. So they made the intro into us, and then the president and the CEO of CGT, which is one of the main LPs that invest into HC9, which is America's biggest private transportation company. So they effectively run the taxis in New York and Vegas and California and different things like that. They said, look, uh, this if we could implement MediDrive into the back end of Sprite, whereas effectively you're booking the appointments, then we can pretty much guarantee that taxis will be booked, right? We
Hmm.
get the patients there. So we did a deal with them. So they've invested through them in HC9 and Mayo Clinic. All in, we've brought in 7.5 million um, on our seed. We were lucky enough that we were able to structure a deal. We're all in. We gave 9% equity, um, but we gave MediDrive and Uber warrants. So effectively, if they bring in 5 million in revenue, 10 million, 20 million, they can earn up to an extra 10% in equity
Hmm.
over 3 years. It was hard work. It's not even, we agreed and signed contracts in November, and we effectively only properly would say funds only arrived yesterday, um, because we had a huge amount of paperwork, documentation. Um, Effectively, even though myself and the other founders were all full time in the business, we didn't pay ourselves any. We didn't have contracts, right? Um, and we had other things that kind of kept us going. But so we had to draft contracts for everybody. We had contractors working for us in Pakistan and Ukraine, and we had to move them to full time permanent contracts. We had to do a flip, do a Delaware flip, and move our entity to the US and have a satellite office out of Ireland now, flipping it the other way around. Um, we had to, like, we were so far behind the curve in a lot of stuff. Like we didn't have CRM, right? So we effectively had to get HubSpot at the start of December and then literally start populating it full of stuff that we could have a report of who our clients were, who we were reaching out to, email
Hmm.
campaigns, marketing campaigns. we then had to look at customer success and how we were going to, because we had one contract. It was kind of odd. We have contracts in the US and we work with the NHS in England, um, but we never really tracked any. It was just like, oh, we know we're working with them, and I'm working with this person, and Dara's working with somebody else. So we weren't very professional, right? So we've had to put a lot of processes in place to get this over the line. We had the whole legal side of it, in regards to, we naively at the start thought, oh, sure, we can use ChatGPT and we can draft contracts and term sheets, which we soon realized we couldn't. Um, so then we had to
Yeah.
bring legal advice, tax advice, revenue advice. We're also we kind of never went to Enterprise Ireland before. And then we went to Enterprise Ireland, and they backed us as well. Now, they haven't put in a huge amount of money, but put it in so we can have their logo
Hmm.
and get access to Irish entities in the US. I think our biggest thing to learn is that we probably could have closed it out a lot quicker if our documentation was better, and if we had tech and processes in place. Um, it was kind of, we were so, our head was so stuck into Sprite and into ESL, what we were building. We weren't really looking at the kind of financials and the business side and processes and everything around that. And we kind of did everything ourselves. So now it's kind of, we also had a development team. We had a CTO, and a head of AI, and an AI team, but we never had a sales function. It was effectively me and Dara, and we didn't have customer success, we didn't have marketing, HR. So and now we've just
Hmm.
literally just hired this week a head of customer success, a head of sales, and we're in the process of hiring marketing people. Um, but I think from my lesson from it was that we weren't as prepared as we thought we were, and um, a lot of it was probably luck, right? Because I know
Hmm.
we tried with VCs and we were getting nowhere, and we had data rooms and everything like, but we never really got. We got to two term sheets, but we never got beyond that. So we never got into the legals or anything like that. So we weren't overly prepared for that, and there was a lot of stuff that came out of the word work that we never expected. Like
But you were, I mean, you were kind of prepared because you had already pre-seed, so it was not just the first round. But
pre-seed,
mhm,
but pre-seed's different. Pre-seed is, you tend to be, they were all angel investors, and they wouldn't have had, they weren't, like, effectively, we weren't dealing with any lawyers, bar maybe seed legals who were drafting the safe agreements because it was on a safe, right? But bar that, we
mhm.
did, like, the people that were putting in, I think from like 25 to 100 grand in that safe round, um, they had no legal representation. Like, it was just seed legals drafted a safe document, they sent it across, they signed it and sent the money over, right? So it was completely different. This was our lawyers dealing with their lawyers looking for preferential shares, and us having to push back on preferential shares, and them looking for drag on and different things like that. There's a huge amount of stuff that we didn't know or understand. Right, like I'd never heard of drag on. Right, so there was a lot of that, and only for the lawyers. The lawyer, like I'd say, if we didn't have lawyers, we probably would have signed up to any. Right, so because it was just we seen the money.
Hmm.
That's effectively what we wanted. But I think the most important thing is having good lawyers or good legal representation. Um,
Hmm.
and I suppose the one thing that was handy for me is that I could use the likes of ChatGPT to explain what the lawyers were telling me or what they were sending me, or the documentation, go in, summarize that for me so I understand it. Right. So um, it was, it's stressful because you're on the edge of a knife all the time going, what if they ask for this? What if we can't provide this? What if the DDD? What if the DD? Not that we didn't think our DD passed, but we didn't know maybe there's something that wouldn't pass, right? Even down to, and I'm very blunt and very honest, we actually paid a company to go into all our social media and delete any mention of Donald Trump, JD Vance, any comments that anybody had anything about anything in the US, just because we didn't know what side these guys weighed on, were they red or blue? So, um, so there's a lot of stuff like that. There's a lot of stuff that comes out that you don't necessarily expect, and even down to, oh, can we speak to some of your clients? We'd like to speak to some of your clients. We'd like to speak to the academic partners that you work with. Um,
Hmm.
like even as far as they wanted to speak to, we had won a couple of awards, and they wanted to speak to the award bodies that gave us the awards to see why we won the award.
Oh
Right?
wow. Wow.
It,
That's a really like diving into maybe you can also like just summarize personally for yourself how did you keep the motivation on? I mean, in times of when yeah, when the term sheets didn't work, it's the first case, you know, like everything seemed to be done and then not again, starting again. And in this time of due diligence, because it feels like meeting, I don't know, a policeman or something like that. You know, you haven't done anything wrong, but maybe you have, but maybe you don't. So it's a little bit like unstable point, I would say.
yeah, it's kind of the VC thing it's odd because you look at particularly all of us are kind of in the same boat, but you kind of look at the size of the rounds that startups are getting in the US that don't even have a POC or an MVP, right? And I came from a large company, so I came from a company called United Health, and one of the people I used to work with started a startup in Seattle, and they raised a seed at 20 million, right, without any clients, right? Where we had worked hard. We built. It took us over 2 years to get compliance and go through regulation to get into the NHS, and then we had to get sign off because we use WhatsApp, so we had to get sign off from Meta to use WhatsApp and et cetera, et cetera. So there was a lot of work went into that, and then we got a contract in the NHS, and we were doing well in the NHS. Um, but the NHS, even though it's the biggest single health system in the world, doesn't pay very well. Right? It's notoriously tight, doesn't pay on time. Right? It tends to pull projects. So you do a successful pilot, they'll just scrap it anyway. Um, so we were kind of used to kind of a bit of negativity or not knowing, but I think the difference is dealing with the VCs here. When we first started, even when we did a pre-seed, we reached out to some VCs and some investors, and we're only raising 500K. But like some of the questions were being asked, and we are dealing with really junior analysts who didn't understand our market, didn't understand what we're trying to build. They're very much heavily weighted. A lot of these people were heavily weighted on, we say, SaaS products that were selling to influencers or sales and marketing and different things like that. So we're 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 effectively trying to change something that's been done the same way for 60, 70 years, right, around healthcare appointments and things. So like we're trying to, in fact, we're not trying to get rid of medical receptionists, but we're trying to make them better at their job. So there was a lot of negativity there. Healthcare, if any of you work in healthcare, will know that it's a really slow sales cycle. Like the average sales cycle is 12 to 18 months. So it's not like they're gonna make revenue really quick, right? Um there's still, because we're AI, there's still a lot of hesitancy.
शुभम जो है ना पहले बात हुई तो Sorry, yeah, muted. It's Amit.
There's still a lot of hesitancy in healthcare around AI, um, and what kind of data you can give or what you can share and compliancy things like that. So a lot of the VCs are kind of, oh, it's sort of like chicken and egg. We want to see somebody else do it first, and if they do it, then we see her coming down. And it used to change. It used to be, okay, get to MVP, one, get a pilot, then get a project, then get a contract, then have an ARR of 2 million, then have an ARR of 3 million. So they kept changing the gates. It was never like it never stayed steady or it never stayed still. So you go back to them, you'd hit that KPI that they said to hit. Like, oh no, the market's changed now. We need to raise more. You need to be bringing in more revenue, right? Or we don't see enough traction. Um, so the VCs changed the market a lot. Um, I think they're more risk averse now, right,
Hmm.
than they would have been before. And um, I think they're going after that. They want that like thing that's going to make money relatively quickly and go Series A, Series B, Series C, Series D, or potentially IPO or be acquired. what we're building is like a slow burn, right? It's um, our system is built to embed into a healthcare system and then spread across a healthcare system to eventually get to the point that it's too cumbersome to take it out, right? So you just have to you just use it. It's sort of like a virus is probably the best way to describe it. Um, so there was a lot of negative feedback there. We had a lot of interest out of the US, but then the whole US thing was, oh, we want you to be headquartered and set up in the US, and that's expensive. If
Hmm.
you're a startup, you can't really afford to be paying those fees and relocation and everything else that goes along with that. So there is quite a bit of negativity out there, but I think my advice to anybody is we lucked out. We got lucky with MediDrive. Right, that's effectively it. Like the situation we ended up in was pure luck. Right, but they're a really strong strategic partner. Right, with a lot of money behind them, and they had something that we wanted outside of the money. Right, so I think if the industry or whatever company you're in, if there is a larger entity or a bigger product there that you feel you can work with or partner with, um, a lot of these larger entities have VC funds, right? Or they invest in potential partners or startups, or if your technology fits in well with theirs and can make their technology better, um, it's easier to sell to a strategic partner than it is to a 23-year-old straight out of college that maybe came from PwC and went straight into VC, right? Because they've never done it. They've never been an operator, right? They don't know what the challenges are, right? They just look at the shiny things, right? So I think if my thing would be to do is to look at going forward, looking at those partners that you feel that you can potentially one partner with and make your technology better and make their technology or their product better or their offering better, but also have money that have potentially invested in other companies. Whereas the likes of CGT, Uber, MediDrive had invested in multiple different companies. They're backed. They have a VC, but it's not their business, right? So, um, effectively, if I was to do it again, now what I've learned, I would try to concentrate on that because for the amount of work outside of the paperwork and the documentation and everything, for the amount of work it takes to try sell your product or whatever you're building and your vision and the founders and the team to VCs or family offices or private equity, right? Don't really get it outside of putting money in, right? Their benefit is unless you IPO or you're acquired or you have an equity event, that's what they're interested in. Whereas the difference is with a strategic partner, they have a vested interest on you being successful because if you're successful, they're successful, right? So, and it makes their product more worth more, right? So effectively, they can charge more for their product. We're making more money. We're getting access to clients we wouldn't have necessarily been able to get into probably now. We might in a couple of years' time, but we're getting access to these guys now. So that's why I think
Hmm.
I would look at, depending on whatever area you're in, look at those larger companies that you can pretty much marry up to or partner up with that have either equity, private equity, or VC, or invest in companies, or have accelerators that potentially can get like one of them is who we are speaking to, but not on the investment side, but on something as intersystems. Intersystems are really good at partnering with startups. They offer grants, they'll invest, they'll give you access to companies and technology you won't get into. Same as what we've done with Google now. We have access to all the Google tech now for free, and into their ecosystem. And we're pitching now next month to at the UK GovTech events and the US GovTech events, just because we went directly to them. Right. So I think it brings more than money. Right. It brings customers, it brings advantage, it brings access to people. Like we're using MediDrive's tech team now because we're moving up on from what we were building, and we literally just started there now this week, but we're building a full orchestration agent for healthcare called Daisy, right, which will daisy chain and connect every part of a health system, right? So, um, and we're doing that with them. We've got access to their development teams and engineers, and we now have access to their sales team and their marketing team. So their sales and marketing function are going to push Sprite to their clients, and we're going to push their product to our clients in the UK. So that's something you should consider. Um, it goes beyond, say, a market study. It goes beyond to going, who can we either create a consortia with or partnership with that potentially there's an opportunity for them to invest in us and we can make each other better. VCs don't think like that, whereas I think strategic partners will.
Yeah, that's a very interesting kind of path of the conversation that we're going into, and that's actually a good way to think about how to be, this anti-fragile, as some people say, on the market. So not chasing the momentum on specific sector or technology, rather than to trust and find the bigger partners, and to think product wise, business wise, and just like to create the value together. And as I understand, I mean, with this being said, I'm just want to kind of anchor here and maybe to go around the founders. Maybe you have something to ask or to argue with, because I can again lead to some other path of this conversation that probably would be more interesting for me as just an observer, so to speak. But then, dear founders, feel free to open your mic and ask questions or express your concerns. Like, what do you want more to know to about strategic partnership, about preparation for fundraising, about smart fundraising, or anything else at that point? Okay, let's see. All right, everyone is thinking. Okay, yes, Andre.
Well, thanks for sharing. It's always interesting to hear the stories of successfully closed rounds. So, well, thanks for sharing. And just a question to clarify. Uh, can you share the numbers you had by the moment you were closing the round, like all the contracts, revenues, tractions, active users? So, in order to get full perspective on that, can you share this?
Yeah, well, I suppose so. Our ARR was at 2.5 million. Um,
No, I mean in terms of the traction of the product, so the number of the cases you handle, the letters of intent you gathered, and the revenue you managed to close, like all these tiny details.
yeah, so it's 2025. We closed with 2.5 million in revenue. Right, we commissioned contract across the NHS. So we're across 7 trusts in the NHS now. We're with Medbridge in the US, which is one of the biggest sleep clinics contract.
So that's two, right?
That's
Two contract. Okay.
no. So each contract within the NHS. So you are commissioned in the NHS, and then your contract is based with each what they call an ICB. So you have
Okay.
individual contracts because it's
Okay.
set. So, say for example, what we do, we work with North Central London, right, ICB, and that's
Okay.
purely cervical screening, all right.
Okay.
We work with East of England, which is on COPD lung screening, and then, say for example, Peterborough, we work on bowel screening. So, but each contract's different because it is a different contract
Okay.
paid out of a different area within
Okay.
the NHS.
Okay.
So then we have Medbridge, which is the biggest sleep apnea sleep study clinic in the US, right? So they have about 326. Qualderm, which is the biggest dermatology clinic. Nemours, which is a large children's hospital in Florida. So we handle kids vaccination programs for them. We're with Mayo Clinic on fertility. We're with Robert Wood Johnson in New Jersey, and then we're with the Mater and St James's in Dublin Hospital,
Yeah.
in the Rotunda Hospital in Dublin. So currently, at the minute, we have 9 contracts, and 2 of those have literally just come in. Right, so Medbridge and Mayo we've just closed on because initially Mayo was a pilot. So we should be this year going forward. We're predicting we probably do an ARR of just over 5 million. That's where we're looking at now, but we could potentially close. We feel we'd probably close more contracts in between then. I suppose the one thing is within the NHS, contracts tend to just pop up. So it tends to be,
Yeah.
right, we want to roll out. So we're rolling out our cervical screening and HPV vaccination program in its entirety across the entire of the NHS by the end of this year.
Okay.
So that works out at it's 189 ICBs across
Okay.
the UK, and then another 19 in Northern Ireland, 24 in Wales, and that's just cervical, right? So, but it's slow, right? So because you're dealing with a public service, so they tend to take longer to do anything than anybody else. So, and in the US, we're slowly starting to spread. Like I think the difference is now what we're finding is since we've got into bed with MediDrive, effectively
Okay.
every week now, as of this week, because we're only back to work this week, but um, this week we've had 3 client calls. We have another 6 the next week, another the week after, and more the week after that. So they're steadily firing clients and us into them. I think the other big thing that we needed to have was obviously, as I mentioned, that we had to get HubSpot in December and put that all down. But we had to get a number of of intents as well. So we have letter intents out of Cermas in Spain, and UPMC in Ireland, and VHI and a number of other companies, and Affidia in Switzerland. So we had to go to them where we're in contract talks effectively with these guys, right? Or we've agreed to do a pilot, but we haven't agreed to do a contract.
Okay.
So
Yeah.
anything like that, as well as, so for example, we got a number of letters from academia. We got a number of letters from, because we're within health and particularly within oncology. So they had a oncology commissioning for the NHS, and the head of cancer commissioning from what they call Cancer X Moonshot, which is a cancer program in the US. So we got letters from them, and we also got a letter from Meta or WhatsApp, because we're actually running a case study on how WhatsApp can be used for patient engagement. So different things like that kind of helped us, as well as, say, for example, some of the awards we won, and we won the pitch at Web Summit and different things like that. So things like that kind of are like to be able to show to an investor to go, look, clinicians believe in us, patients believe in us, hospital systems are believing, our clinics are believing in us, and they're using our
Yeah.
product as well as patients. And we also got patient referral videos from patients to say why they found the product a lot easier to what they were using. So
Lots of data points, lots of traction. Seems like investors should be throwing money to you literally, but I don't know. Thank you.
Perfect. Yeah, thank you so much, Andre, for the question. Any more questions, or you want to dig into something in details? Because I would go probably into, I mean, what I see again as a very sometimes sensitive point during fundraising. So we're just speaking about the process of fundraising here, is negotiations part. So okay, of course, like we can speak where to go for the first contact, network, and I mean partially it was already mentioned, but then when you are going to negotiate the terms on the matter of, okay, we are providing this for this, and equity wise and evaluation wise, etc., etc. Maybe here you have some learnings. Also, so I'm speaking still before term sheet kind of part. You have some learnings on that point on how to keep enough I mean, how to hook probably the investors enough to go up until term sheet. Or also in a matter of, you said that first you got one investor who was not ready to be a lead investor. That's also rather a typical situation, to be honest, for seed startups, when there is an interest, but they still need to kind of work on and find this lead investor that kind of will, collect all the puzzle, all the consortium around. So maybe some points in that sense, as you see. And was it also different from, I mean, of course, it was different from the precedent, from the angel negotiations, but yeah, maybe something to think about, especially towards the rounds with institutionalized investors, so to speak.
Yeah, so I think it's things that you were necessarily asked for, right? So I think we kind of always went in with we've always known that our main market will be the US, right? Because that's effectively where we can have the biggest effect because it's a privatized market, so it's a capital health system. It's probably one of the most unfair health systems in the world. It's the most expensive healthcare system in the world, right? So, and we always knew that we had to build something that had an ROI, as in it will save time, it'll save lives, but most importantly, in the US, it'll save money, right? Um, so we had to have all the documentation around that, and I think the thing that we had to figure out is because we, unlike some startups, we didn't come out of academia, right? So we then had to go and find academic partners to create white papers and create reasons on why what we're building will make a difference and why it's worth investing in and where the market's going to go. And we're the first that's used WhatsApp for no-show prediction and scheduling and patient engagement. They use WhatsApp in the Middle East and other countries in regards to send you out a message to say, "Oh, your appointment's been booked" or whatever, but they don't really engage the patient, right? So we had to have all that documentation. We had to know our numbers. We had to know that look, it wasn't fluff, right? As in, we had to know how big the no-show market was in the US, which is $220 billion a year is lost to no-shows. We had to know how much money they spent over $1 trillion in scheduling and billing in the US alone in healthcare. We had to know the socioeconomic backgrounds, who were the most likely people that were going to no-show, what were the reasons why they no-show, what are the main languages, and we had to develop a roadmap as in predominantly at the start, and where we are now is all text or messaging. Um, we've partnered with 11 labs, so we're building a vocal agent, which is like 45 different languages as well, that can have a full conversation with the patient, and we've tested it and it's working. But we had to know what we were doing there, and then we had the whole thing with the ability to provide transport and predicting outside of predicting the patients turning up. We had to know what we were building because that only gets you so far because there is a lot of other scheduling companies out there, right? But we wanted to go beyond them, right? So we had to have already mapped out what we were going to build next and how we were going to build it and what technology we're going to use and stuff like that. So we had to have that. As well as we kind of learned from dealing with the VCs, and particularly the two that we got to the term sheets, as in what they asked and what they wanted and what they didn't want, right? On the first one, we learned quite quickly because we literally did a dump into a data room and we had way too much in it, right? And then they were going, like, it was taking ages. Oh, every time you'd reach out, oh, we haven't got through the data room yet. We had far too much in it, right? So it just happened that I knew somebody else who'd done the seed series and series A and a series B, a friend of mine own. So I asked him to take a look at our data room. And he went in and he said, take that out. You don't need this. You need to put this in. And he kind of audited it and said, this is what you want. This is what you don't want. That's what they want. That's what they don't want. So we did that. We had, we knew exactly how much we were willing to give away. Right. We also knew, not that we ever got the chance, but we also knew when we'd walk away. So when we're going to walk away from a deal, right? To know that. As well as it's a saying in Ireland, never tell anybody how you make your sausages. So only give them enough to get them interested, but don't give them enough to, because potentially the other thing is I've seen this before, and I know people it's happened to who went to, whether it's VCs or private equity or family offices or high net worths, who they went and showed everything and showed them how to do everything, and all of a sudden a competitor is then coming out with something or something similar to you, or launching a thing like that. So we were very we told them what we do, but we didn't show them how we did it. Right. So and that was important. And I think once you maybe get into a Series B or Series C, you kind of have to be that in depth. But I think if you're doing seed, pre-seed or a seed, like seed plus maybe, what we've learned is you don't need to give out as much information as you think you do. At that stage, when you're getting to a point, whether you're getting to a term sheet or you're negotiating to get to a term sheet, right? And the other thing to be aware is that what you negotiate on the term sheet doesn't necessarily mean that's what you're going to end up agreeing to or signing to, right? Because we had agreed everything on the term sheet with this investment, and then when their lawyers got involved and our lawyers got involved, next thing it was like, well, we want this, and we want preferential shares, and we want warrants, and we want this and this and this and this and this. And that's what dragged it out. I'll be honest, at one stage, the week coming up to Christmas, right, I was like, F this, I'm walking away from this. It's just too much hassle. Right. Um, so you kind of have to be prepared for that just because you get to a term sheet. And even if you get past the term sheet, it always changes, right? You don't get what you think you're going to get. And no matter how well you get on with the investor or the VC or the private equity or the family office or whoever strategic investor, people are in it for a reason, and they will try screw out of you the best on that deal that they can get on their side. Right. So you need to kind of protect yourself and know, am I giving away too much now, or is something going to bite me in the ass further down the line? As in, or what happens if we do a down round? What happens? If they're getting preferential, they're getting the shares out first. So what am I
Mm.
left? Right. So, and I think that was an interesting thing, like because it's like the amount of documentation, contracts, where the entity were like even through us, it was like the investment was coming in, and then they suddenly decided they were going to change the entity that they were investing out of, so they had to set up a new company. So there's quite a lot of that, like that we wouldn't have had experience with before, and we didn't know anything about because we were techies, right? So, um, I'd say people say once you get to Series A, Series B, it gets easier, right? Because you've got traction now.
Or maybe you also delegate,
Yeah,
lots of
like
things.
I wouldn't do this on my own again. Like that's for sure, right? Well, I'll say on my own with my founders, but I wouldn't. I just give it to somebody else and let them handle it. But um, you know what they're doing. But I think the negotiation never ends at the term sheet. It literally you're still negotiating up until the point that money hits your account, and 30 days after that Pacific cooling off period now. So you have that 30-day thing where they might go, no, we're out. So you just need to sit on the cash for 30 days. So
Crazy. Yeah, but anyways, I think that you've also kind of integrate lots of founder mindset points into that, like what mindset should founder or co-founder has just overall, day-to-day business, because it's like if you think that everything is so innovative and fast and great, like your product is, probably there will be something to compensate that. There will be risk averse people. There will be this tough and very speaky, I don't know, negotiations and conversations. And yeah, I think that it's kind of balancing this startup world of the solutions, and everything is going great. And that side, integrations and AI and blah, 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 versus, or not versus, but together with people interactions. So that's definitely true. All right. Again, I am just stopping here because I can listen to you the whole day regarding the points, and also find very interesting ones for myself. But again, maybe some questions, or you want to know more about some specific things on the fundraising part. Please feel free to unmute and just go ahead with the comments. Yep. Well, today we're Andre, me and you are just poking.
Oh, that's interesting topic. So Neil, was it priced around, or did you manage to get away with safe like agreements?
So no, we did save for pre-seed, but for this round, this was priced. This was an equity round. So
Uh,
so they so between them, Mayo Clinic, we gave away 9% equity, but which we thought was pretty good. But they got warrants in regards to that if their revenue or sales team bring in percentages of revenue, they got obviously they get money on top of the revenue, but they also get the opportunity then to take more equity in the business. So there's an upside for them, but there's an upside for us because effectively, if they to get to an extra 10%, they have to bring in 30 million. So if I'll happily give away 10% for 30 million in revenue. So
well, and did the investor insist on setting up the board of directors already and all this kind of things?
they asked for an observational board seat,
Hmm.
but so we early on, and we I went out with the intention to build what I call the Avengers of the board, right? So we have Kerry Holly, who's the inventor of IBM Watson and the ex-head of Google AI and United Health on our board, and we have the ex-CRO of Blue Cross Blue Shield, and Rory Sutherland, who's one of the founders of Ogilvy. So and Rick Kelly's the ex-head of Meta for EMEA. So we went out with the intention of bringing these people on very early to be on our board because they also got us into like Rick Kelly effectively got us the deal with Meta to use WhatsApp. Um, so we went with that intention, and when they seen the board, they were like, "That's our board was more impressive than their board." So so they were like, "Look, we just want an observer seat," and so their president is joining our just as an observer. So
That's a good position to be in, I guess. Oh, thank you.
Yeah, that's a really funny yet irony of life, comparing the boards in this case. All right. Anyone else here to ask question? Because that's interesting that they were not kind of going into this board of directors or like, pinning the point. Because I think this is one of the main points in negotiations where you need to think, very long term. Because if you give the seat to the investor on the early stage, then you're kind of you have the obligation for the next ones and the next ones and the next one, and then it's kind of goes,
we
unless you have the strategy.
like to be honest, we were actually expecting that they wanted a board seat, right? And the lawyers had told us, look, they're going to look for a board seat or at least maybe one or two seats.
Mhm.
And met with them. We went and played golf with them before Christmas, and they were like, "Look, you think you have a strong enough board?" Because we kind of actually wanted their president to be on our board because he's ex Mary Health and United Health and large hospital systems, so he would look good on the board anyway, particularly for clients, right, for his level of experience. Um, but he said, "Look, I'll take an observer seat." But he's on a number of other boards, and he's busy building this and blah blah blah. So he was like, "Look, I don't want to commit to a full board role." Right. So that's again, I'll be honest, it's not anything I did. I think a lot of it is luck. Right? And we just were lucky. Right. We were unlucky at the start because it took us so long to raise it. But I think there was just maybe I'm Irish, so maybe there's a bit of luck.
I mean, it's still like after all the due diligence, as you have briskly mentioned. I think it's not a luck. It's well prepared work, and of course there were some um, corners or loops to be taken, and all this tough work that you would do differently. But if you were going through it right now, if you wanted to, of course. But yeah, I mean there is luck in everything, but it's not just luck. So I'm pretty sure that that's huge work, and kudos to you and your whole team. All right. Well, then I would ask more, or maybe like we can dig into more on the looking forward. So now that you have yesterday, right? The tranche arrived. Congratulations. So now you're not sitting just on the couch, as you said. And so do you like what are you feeling right now, and what are your first steps? You're like, okay, we're going with a roadmap, or we're just like, because suddenly all of a sudden this huge burden of all the due diligence and negotiations and talking about it resulted into something, and now, or you are ready and you have been ready, before even fundraising, to get the money and go quickly to the market, or to expand into the market. So yeah, like overall the feelings and the plans probably for the future.
And obviously, it's great to have it in, and there's the excitement around that and everything. But then it's suddenly it's slap around the face. Go shit. Now we actually have to do this. So like, so we're not answering to anybody else. So we're it's not that we only answered to ourselves before now, right? There was no the expectation was on us, right? So if we messed up, we messed up, or we didn't bring in money or revenue, that was our fault. But now there's an expectation from an investor who's put a considerable amount of money in, right? As well as the expectation that we're merging their product into ours, right? So we have to do that correctly, right? Because it's if we do it wrong, it's not like we take Sprite down. We could effectively take them down with us, right? Or they could take us the other way around. They could damage our brand. So there's that kind of hesitancy. We need to do this right. We can't just rush into it, right? And we've given ourselves a timeline, as in we're not just going to throw these things together. We're going to effectively work it out. We had been to the US, but now there is the realization we're going to have to be there a lot more, right? So travel a lot, and the expectation is now we're going to have to hire a lot of people, right? But we have to make sure we hire the right people. And I suppose my background predominantly, I was in HR and recruitment for nearly 20 years, led HR and recruitment strategy in United Health. So I have an experience in that, but it's tough. It's actually hard to hire and recruit. And but to us, we brought in a considerable amount of money for us, but that's nothing compared to hiring budgets that we're going to compete against have, right? And we can't pay all the benefits and the bonuses and everything these companies pay, so it's going to be hard on that side. And because it's to grow in the US predominantly, and as well as what's currently happening in the US, kind of makes you wary, right? So,
Yeah.
so
Yeah, but that's also very funny that you mentioned this topic overall. I mean, me as a program manager just thinks about um, the importance of general media training. I'm calling it media training for founders, but like something how you present, maybe not for the media, but for the external parties that can be actually your potential stakeholders. And you mentioned the post management, right? Like deleting stuff that could be potentially risk of et cetera, et cetera. And I think that we are coming into that time when, on the one hand, yes, of course, we are easygoing founders. We are, very flat structures and transparency and so on and so forth. But on the other hand, this cautiousness.
yeah,
It's kind of it's growing really deep into the heart of the tech solutions even.
it's
So
not.
that's a
It's
huge discussion in itself. I understand that, but that's just so funny that even on the topic of fundraising, we're touching upon it.
yeah. I think it's there's that expectation now. I think we haven't. We'll make the. I think we're making the official announcement next week or the week after, right? So that'll go out obviously in press releases and different things like that. So then that creates an external kind of pressure, as in, well, we expect these guys to grow, right, and do this, and so probably it brings on like now you kind of feel okay. There's probably more pressure on our shoulders to perform than there would have been when we weren't exactly stealth, but we weren't setting the world on fire, right? Like so now there will be that there's greater expectation on our shoulders,
Yeah.
as well as the
But
fact
you will be able to you will be able to achieve your results. I'm
we
pretty
hope.
sure. And
So
yeah,
I
yeah,
hope
yeah. No, no. I mean, like, yeah, amen to that. But nevertheless, I think that yeah, that's something that I see happening. And well, with this being said, if no one is uh, like jumping with any question, because I'm still like kind of putting the 4 minutes to probably some 3 minutes already for some final questions. Then we are going to wrap it all up. Maybe some final words from you, Neil, and yeah, we will get it going.
look, um, for the time that I was in Constructor, it was great. I wish everybody on the program the best of luck. Connect to me on LinkedIn if you're not already connected, or send me a message on WhatsApp if you want to ask me anything, or if you need any intros, or if I can give any advice. I'm happy to do it. And look, you're all building great things, so I'm sure one of you will be on doing this sometime in the future. So, sorry if I talked a lot of waffled, but happy to help anybody. And if I ever can do anything for anybody, just reach out to me.
Perfect. Thank you so much for also being so honest and speaking really frank about some of the things. That's yeah, really grateful for that. And yeah, wishing you all the best, and we're staying in touch. So whenever you need anything from us, or from each of and every founder here, or from the program team, or from me personally, we'll be happy to help and assist.
Thanks.
And with this being said, well, everyone, I wish you a very nice Friday afternoon and evening, and a great rest of the week. Probably productive, probably recharging. Never know. It depends on your plans. And we'll see each other again next week, which is about marketing, sales, and business development. Thank you so much.